Welcome to the Hard Hat Training Series. Today, you will learn about safety principles as they relate to bloodborne pathogens, also called BBPs. We will strive to provide information that will increase your knowledge and make you a safer worker. No matter the industry in which you work, healthcare, construction, maritime, manufacturing, and so on, there are certain tasks that most likely lend themselves to injury more than others. Regardless of whether an accident is deemed serious or not, if any one of those injuries draws blood, then the potential for a more serious illness passed by way of that blood is a very real concern. This is where bloodborne pathogens training comes in. We will explore the more technical definition shortly, but let's start with this. Bloodborne pathogens are a type of microorganism, meaning they cannot be seen with the naked eye. They can enter the body in many ways, hiding in blood and fluids, and they spread easily. They may seem harmless, however, despite their size, they are not only extremely dangerous, they are potentially deadly. With that in mind, the goal today is to keep you and those around you safe by providing information that will increase your knowledge of the common risks associated with exposure to bloodborne pathogens. More specifically, we will describe what bloodborne pathogens are and why they are so harmful to our bodies and health. We will describe the types of diseases that may occur due to exposure to bloodborne pathogens, namely hepatitis B, hepatitis C, and HIV, just to name a few. We will also show you how bloodborne pathogens are spread, how you can easily be exposed to these microorganisms, and how serious contamination becomes possible in the workplace. We will discuss safety tips and precautions by explaining how to properly dispose of potentially contaminated waste, decontaminate surfaces and objects that could spread disease, contain possibly hazardous material, and use the appropriate protective equipment and gear. We will discuss post-exposure procedures such as how to treat the illnesses that may occur because of exposure, as well as the importance of reporting incidents. Upon completion of this training, you should be more knowledgeable about the cause and effects of bloodborne pathogens, have a better understanding of the diseases that may occur, comprehend how they are spread, know what to do after dangerous exposure to contaminated fluids, know the proper way to handle, clean, and store contaminated fluids, and be better prepared to ultimately prevent the spread of BBPs and disease. Let's get started. These are some of the main standards concerning bloodborne pathogens. Many provinces have additional standards, as do some industries. We have provided these as a guide, but it is your responsibility to know all federal, provincial, local, and company rules that apply to your situation. Regarding these standards, it is common to hear both employers and workers in the construction industry state that the BBP standard does not apply to them. Technically, they are correct, but only inasmuch as the construction industry did not play a role in creating the standard. However, as noted, whether a specific standard exists or not, the regulations make it clear that the employer must train all employees specific to the potential hazards in the workplace. That means if there is a chance for injury, and if, through that injury, there is a chance for blood communicable diseases to spread, all affected workers need to receive training specific to the hazards and how to prevent them, as well as how to handle a situation when blood is present, like using appropriate